Today, I'd like to take the time to introduce you to the capabilities of Webex Connect with a focus on the patient journey. Webex Connect has established use cases across the whole of the patient journey, from the initial referral, including registration and capturing of communication preferences, through appointment notifications and reminders, integrated portal notifications, virtual assistants and chatbots to chronic care and post-discharge support and engagement with patients, as well as the automation of pharmacy fill-up and billing and payment processes. Today, I'm going to focus on just 3 specific use cases. The first being patient reminders and self-scheduling, followed by virtual assistants or chatbots, and finally, virtual and remote monitoring. So appointment reminders are commonplace, and it's not just in health, although the most common profile of a reminder in health is a simple one-way message instructing patients to call into what is an already under-resourced booking centre, which compounds the challenges that the teams face by increasing call volumes, causing patients to have long waits or being unable to get through at all, which gives a poor patient experience. And that does mean that some patients will simply hang up and then not show up to their appointment. By utilising conversational and digital channels, the simplest of those being SMS, Webex Connect can facilitate a fully automated process, allowing the patient to respond to confirm, cancel or rebook. And with Webex Connect's flexible integration suite and the application of localized business logic and rules, we can facilitate real-time interactions directly with the EHR. Patients can conveniently self-service and rescheduling in real time, 24/7. In fact, 68% of patients are more likely to choose a medical provider that offers the convenience of online or automated appointment management. Conversational reminders are proven to reduce no-shows by as much as 50%, maximising the capacity and utilisation, maximising your revenue potential, reducing the rework, the back-end administrative work that comes with no-shows. Increased attendance ensures that treatments stay on track, delivering the best health outcomes, supporting a value-based care model. So moving on, as mentioned previously, the majority of communications between provider and patients result in a phone call, either in response to a hospital call to action or being initiated by the patient who is after some further information. Hospital phone lines are inundated with patients seeking information, and they don't always require live human interaction. Virtual assistants or chatbots are becoming increasingly popular, and as the use of AI, natural language processing and understanding, or NLP and NLU advance, bots are able to handle increasingly complex queries. They needn't be overly complex, that said. An FAQ chatbot can be deployed in around 6 weeks and made available to patients via your website, social channels, patient portals. You could even include a link within an appointment notification or a welcome text going out to patients. So rather than direct all patients or citizens to call if they have a query or to go to a website that's difficult to navigate, deflect into the digital channel first. Empower people to self-serve. Provide a trusted resource of information, as well as being able to reference external trusted resources and specialist resources as and where required. Chatbots do also have the capacity to handle multiple conversations at any given time. Whether that's 5 or 5,000 questions being asked, all will be handled simultaneously. In one large acute hospital, having deployed an FAQ chatbot, they saw over 21,500 queries handled in the first year, saving hours upon hours of staff time, the equivalent of 1.3 full-time equivalent from a staff resource perspective. Imagine how much more they could be doing with that time supporting those patients that do need to have that live interaction with a human. Taking that virtual assistant one step further, they can be used to support and enhance tasks such as rescheduling of appointments. This short video demonstrates how the virtual assistant can do just that. And as you saw with the reminder and scheduling flow, the integration with the EHR allows Webex Connect to offer Pete an appropriate and available slot in order for him to rearrange his appointment. So by empowering citizens to be self-sufficient and deflecting calls away from the booking and the contact centre teams, you can significantly reduce call wait times, enable your staff to focus on the more complex and urgent calls that are coming in from patients, and therefore improving the patient experience, improving staff satisfaction, and delivering greater efficiencies for both patients and staff. Webex CPaaS solutions can help providers deliver healthcare beyond the hospital walls With AI-powered monitoring bots and conversational digital channels, Webex Connect can support remote monitoring and post-discharge care. From low-risk recovery from procedures or chronic condition monitoring, Webex Connect supports patients to self-manage with regular digital check-ins and easy access to their care teams. There are plenty of studies that evidence the fact that patients recover better in the comfort of their own home. By removing all the travel and disruption and providing assurances that they can communicate with their care teams when needed support, improves health outcomes. Patients can instantly alert teams of potential recovery issues to reduce risk of infection or readmission, with the option to send pictures as part of that. So Webex Connect can help bridge the gap in staff shortages by reducing the in-hospital monitoring and face-to-face care required for low-risk procedures. This short video gives an example of how Webex Connect can support remote monitoring, sharing appropriate information and providing details on how the patient can contact their team. When the patient does make contact, there is a short triage to collect all relevant information so that when that's escalated to a member of the care team, they've got all the information they need to hand in order to make an informed, structured decision, and they can then respond appropriately. Improved outcomes, remote monitoring post-op can lead to better results, shorter recovery times, and high levels of patient satisfaction. The biggest challenge with introducing technologies is to ensure that we never leave a patient behind. So with the support of multi and omni-channel communications to seamlessly connect with patients on their channel of choice, digitizing the patients using business logic to enable proactive conversational messages and real-time interactions. Thanks for taking the time to listen today. If you have any questions or would like to see more demonstrations, please do contact your Cisco account manager.